All right, in chapter 11, we are now focusing on some different eating disorders. So essentially our learning outcomes or study guides is just kind of looking at what it means to have an eating disorder, how they begin, and then going through some of the main ones like anorexia, bulimia, binge eating, and then some others, understanding, again, kind of their physical and mental characteristics as well as their treatment. So first of all, just going from an ordered to disordered eating habits. So everybody has kind of an image of an ideal body. Of course, the media promotes it. Dieting is promoted to achieve it. But again, kind of focusing too much on this can lead to a disorder and a need for social acceptance. So images of acceptable versus unacceptable body types constantly being shown, mainly in the media, but in other areas that can lead to the idea of wanting to maintain an ultra slim body type is kind of a common goal in today's culture. So of course, food is more than just a source of nutrients. A lot of times it is part of our emotional support system, our comfort. So again, stress eating or kind of a socializing aspect. So it stimulates different neurotransmitters like natural opioids called endorphins that kind of lead to that reward. But they can even kind of bribe us into leading to a disordered eating. So almost like an addiction. So again, since food releases some of the same neurotransmitters, then in some ways we kind of become addicted to it. So this disordered eating may require some professional intervention if it becomes sustained or distressing, so emotional eating once or twice, or stress eating, that doesn't indicate necessarily disordered or a disorder, but that sustained idea of doing it multiple times, or if it starts to interfere with our everyday activities, and oftentimes it is linked to some type of physiological change, so becoming too underweight, leading to different disorders like anemia, where we don't have enough iron or enough nutrients, that causes other problems. So where do these disorders kind of originate from? So many of them start with just a simple diet. So the main types of eating disorders include anorexia, bulimia, and binge eating. So those are the ones that we're going to mainly focus on as far as what are their characteristics and ways to treat them. But in addition to this kind of simple dieting, genetics is of course a big factor. About 50 to 83% of that is genetic for kind of being predisposed to having an eating disorder. So identical twins are more likely than fraternal twins to share in that eating disorder, again indicating there's a genetic link. But also different environmental factors can play a role regarding how much attention one pays to social media or exposure they have to it. Families and just kind of the family dynamic. If parents are very diet conscious or weight conscious, that can kind of be passed on to the children as well. All right, so just kind of how this progresses from ordered to disordered. So attention to hunger and satiety signals, limitation of calorie intake to restore weight to a healthful level. So then that kind of increases into some disordered eating habits, begin as weight loss, but then becomes very restricted in the eating patterns. So as eating becomes more and more restricted, then it can become clinically evident that the disorder is there. There's not a proper eating habit trying to lead to that weight loss. All right, so what are some of the changing phases that we see? So typically they develop during adolescence or young adulthood. That is whenever most of them occur, and they often co-occur, kind of come along at the same time as different psychological disorders. And this crosses different ethnic and cultural groups. So it's not just kind of our upbringing. Again, there is just the media, there's genetics as well. So it's not like one group is more prone than another. So recognizing that disorder is critical for the treatment. And they're diagnosed using specific criteria of what's called the DMS-5. And if you've taken some psychology courses, this is what's used as the diagnostic and statistical manual for mental disorders. So again, because they go along with a lot of psychological orders, that is what is used to diagnose them. So looking at men versus or women versus men, 90% of anorexia occurs in women. And this is just kind of that kind of unnatural thinness standard that is propagated through different media. Only about 10% of men or 10% of anorexic and bulimia cases are men. However, it is a little more common in binge eating disorders that we'll talk about a little later. That is a little more common in men than what anorexia or bulimia is. Now in athletes, different competitive sports, especially like wrestling is indicated here, that have weight classes that can lead to disordered eating behavior to get that competitive advantage or to get into a specific weight class, or like jockeys who need to be thinner so that their weight doesn't add to the horse and they can be faster. So some different sports can also make individuals more likely to have an eating disorder. All right, so starting with our first one here with anorexia. So there are three main characteristics, and that includes extreme weight loss, irrational fear of gaining weight, and a distorted body image. So typically individuals, so as this picture is kind of illustrating, this is what the individual actually looks like, very thin, but they see themselves as being overweight or obese. So that distorted body image that occurs. No matter how much they lose, they just still feel as if they're overweight. So the diagnostics, again, the three things they're looking for based on that DMS-5. So again, extreme dietary restrictions, again, not eating a whole lot, overwhelming distress about gaining weight. So again, additional stress, just fear and anxiety that comes along with eating, and that disturbed perception of one's own body or shape. So overemphasis on body weight or shape determining their self-worth, or just failure to recognize how dangerous it is that they have such a low body weight. So some of the common behaviors, again, extreme dieting, so eating very little food, if any at all. They have safe foods and only a few things are on there, so like different vegetables or fruits commonly. Hiding or storing food, driving for perfection, so just the mentality that they have to be perfect in all aspects, preparing meals for others and then not eating, and then some compensatory behavior. So if they are eating, then they follow that up with vomiting, laxatives, or excessive exercise to burn off whatever they have consumed. So that typically leads to some withdrawal from family and friends, weighing themselves very often, and very critical of themselves. The physical effects, so lower body temperature and cold tolerance. So they're typically very cold because they don't have a lot of body fat to kind of regulate that body temperature. So again, that insulating layer of fat, slowed basal metabolic rates from thyroid hormones being kind of out of whack. Decreased heart rate and loss of heart tissue. So without our blood pumping and getting our oxygen, that leads to fatigue and fainting, very tired. Again, just due to poor nutrition, leads to a deficiency in iron that causes weakness as well. Again, iron helps our hemoglobin transport oxygen. Skin becomes rough, dry, kind of scaly, even cool. Our white blood cell counts would go down. That increases our risk of infection, kind of a feeling of kind of fullness or bloating, and then even hair loss can occur as well. Some additional ones, so impaired swallowing, constipation typically due to using laxatives when they do eat. Low potassium can actually lead to death from that malnutrition. Loss of menstrual cycle, again, altering our hormonal balance. Muscle tears and stress fractures, because again, not enough protein to keep our muscles in check. Changes in brain size and mood due to neurotransmitters not functioning properly that can cause that depression. Again, lack of calcium that leads to low bone mass, and loss of teeth is kind of the lasting sign of the disease. So just kind of looking at all three of the main ones, so anorexia, bulimia, and the binge eating disorders. Again, just kind of a nice little Venn diagram here to look at some of the things that they have in common, and then some as far as those physical characteristics like anemia, low blood potassium, irregular heart, dental problems, constipation, and then some overlap here with sleeping, as well as immune problems that occur, and then again some that are unique to anorexia and some that are unique to bulimia, and those for binge eating. So this is a really good figure to kind of study on and to look at the comparisons and contrast so you can identify which symptoms they all have versus which ones are unique to each disorder. So again, nice figure here to study. All right, so then treating individuals with anorexia. Again, because of that isolation and fear, the hardest part is getting them to identify that there is a problem. So some types of intervention can be helpful, but it typically takes multiple teams, so multidisciplinary. So of course their doctor, but also a dietitian, psychologist to help with the psychological issues. Some eating disorder clinics may be needed, whether it's outpatient therapy or hospitalization if it's a severe case, where again, nutrients are significantly decreased, especially that potassium. And then, of course, those require money, so insurance can cover some, but typically not all of the costs, which also hinders individuals from getting the help that they need. So some of the nutrition therapy goals, it's mainly as far as the treatment, is just getting cooperation and trust, increasing the food intake to get that basal metabolism back up, and then just keep working up. So building slowly to increase that intake and to prevent any further weight loss. So the idea of trying to gain a couple pounds a week to restore those normal food habits, restricting excessive activity, and ultimately just getting and maintaining a healthy weight, as well as emphasizing that calcium and vitamin D intake to help with their bone mass. A little bit here about our microbiome and kind of back to those good bacteria. So they actually produce compounds that help regulate our mood, appetite, and GI symptoms. Unfortunately, they are reduced in number and activity in those that have anorexia, both before and after that rehab. So they can flourish potentially to improve that physical and mental health outcomes for individuals in recovery for eating disorder. So different probiotics and prebiotics can be used to kind of help to restore that normal microbiome, to replenish those good bacteria to help with mood and appetite. All right, so some of the psychological therapy that can go in to the anorexia is, again, just kind of determining what started that emotional kind of problem that led to that distortion. So can show how to regain control of that to kind of help cope with other situations. Again, especially if it's a secondary, treating the initial problem can then lead to treatment of anorexia. Using cognitive behavior therapy and different support groups, and family-based therapy is also preferred to have that support system. There are some drugs that are out there. However, typically medications are not effective in treating this. So food is actually the drug that they need for these individuals. However, Vyvaci is one that has been approved for binge eating disorder, which is a stimulant to treat attention deficits and hyperactive disorder, so ADHD, but has been shown to also be effective with binge eating. Prozac has also been used to kind of stabilize recovery once individuals get to about 85% of that weight. It's an antidepressant, but again, typically food is what is needed rather than a drug that kind of stimulates that appetite. So, however, with that professional health, many go on to lead normal lives. So, again, about 20 to 30% recover from short-term therapy, and then 70 to 80 though with 8 years of follow-up. So it is not something that just goes away. So similar to addiction, it's something they typically struggle with for years and years. So that continued support is very important to having lasting recovery. All right, so moving into bulimia. So this is kind of, it actually means ox-like or ravenous hunger. So in this condition, there are recurrent episodes of binge eating and then followed by compensatory behavior to prevent the weight gain. So binge eating followed then by the guilt that they then need to get rid of those calories. So those compensatory behaviors, those are the actions taken to reduce or rid the body of excess calories. Again, alleviate the guilt or anxiety caused from overeating. Typically, vomiting is what's most used and what we typically think of, but also using laxatives or even excessive exercise. So again, overeating followed by some type of activity to try to rid the body of those excessive calories. So kind of the characteristics that go along with bulimia. So this can lead kind of secret lives, kind of hiding that abnormal eating habits. Again, only about 10% in men. They're predisposed to becoming overweight. So they're slightly at or slightly above their normal weight, and where they've tried different like dieting plans and haven't been effective. Also individuals with impulsive behavior that leads to that binging. So that binge purge cycles triggered by some other type of emotional factors as well. So some of the common behaviors, so again, hidden binge purge habits, elaborate food rules. Binging can consist of actually more than 3,000 calories. So again, that overeating, especially convenient high sugar foods, that loss of control, and then following by the purge, like vomiting, laxatives to avoid weight gain, or again, excessive exercising. So the diagnostic using the DSM-5, so repeated binge eating characterized by eating large amounts of food in a short period, experiencing a loss of control, overeating during the binges, repeated use of unsafe means of preventing. So again, that purging, like excessive vomiting, using laxatives, diuretics, that type of substance. Then the binge compensate cycles occur at least one time per week for 3 months. So again, kind of that consecutive behavior that's looked for. Undue influence of the body weight in determining like self-evaluation. And the behaviors are distinct from binge purge of anorexia. So again, anorexia is more limiting, not eating a whole lot of anything. But even when they do, there can still be that compensation of binging, or sorry, of purging. However, here with bulimia, there is that binging that occurs followed by the purge. All right, so this binge purge kind of vicious cycle here that occurs. So again, there's some type of anxiety that leads to overeating and binging. Then there's the fear of gaining weight from overeating that leads to the purge. Then there's the fear of losing, the fear of that fat gain Then they feel guilty about all that. That leads to the anxiety, and then we're back again. So unfortunately, this cycle that's very hard to overcome. Now, the effects that occur, so actually absorbing those calories, about 75% are absorbed even after vomiting, and 90% are absorbed even whenever laxatives are used. So even though they're trying to purge, really most of those calories are still being absorbed. So they can cause weight gains and weight fluctuation. Then that leads to the guilt and depression, the low self-esteem that leads to the overeating, and that cycle again continues. Now the physical effects, so vomiting causes most of the problems that are associated with this. Demineralization of the teeth due to that stomach acid, a drop in the blood potassium, again from excessive vomiting, kind of dehydration effects. Swelling of the salivary glands, this is unique to bulimia, and stomach ulcers and bleeding, and constipation. So again, most of the physical effects are due to the vomiting that occurs with it, because they are actually absorbing a lot of the nutrients, so they don't have the nutrient deficiencies that are seen with anorexia. Again, just our figure again, but if we look at specifically the bulimia, so again, those swollen salivary glands, irritation of the esophagus and stomach ulcers that are unique to bulimia because of the vomiting that typically occurs. Again, there can be some iron and potassium deficiencies, and then that can then lead to some problems with the heart rate. Again, the dental decay, that's mainly from the acid that occurs, and constipation. So treating bulimia, so first of all, correcting misconceptions about food, so that psychological part, establish good normal eating habits that decrease the amount of foods that are consumed to prevent the binging, decreasing the purge after that, and just developing those normal eating habits. Again, the psychotherapy is very important to help with that self-acceptance that leads to the guilt and the anxiety. So group therapy is very important. Some drug therapy or pharmacological therapy, so Prozac is the only antidepressant that's approved for treating bulimia. Again, it is typically treated by the psychotherapy that is used to help establish those good eating habits. However, Prozac can be prescribed sometimes for treatment.